Barb George, Director of Critical Care, Progressive Care, Co-Director of Accountable Care Readiness Pilot at St. Elizabeth Regional Medical Center in Lincoln, Nebraska. The Accountable Care Readiness Pilot is a pilot to see how we can keep patients out of the hospital with chronic conditions. So the chronic conditions might be congestive heart failure, diabetes, COPD, pneumonia, and if we can teach them how to take care of themselves when they're at home, taking the medications, eating right, then they'll no longer have to come into the hospital. And that's what we want, because then they have a better quality of life at home. The components of the program are the Geriatric Care Coordinator, which is a social worker who is based out of the physician network, the office-based health coach, which again is at the office of the physician or wherever the practicing provider is at, and then the Care Transition Intervention Coach, which is based out of the hospital. The office-based health coach and the Care Transition Coach are RNs to do med reconciliation, to fill out a personal health record booklet, to see if there's any questions that they might have prior to seeing their primary care provider, which they saw within 7 days of discharge from the facility.
Barry Hoover, I'm the Chief Medical Officer for the Physician Network in Lincoln, Nebraska. Our physicians take great ownership and pride in their relationship with their patients, and I think it was hard for them to share some of that care with other people they hadn't worked with before. Once they recognized that they weren't losing their own relationship with the patient, but that our other coaches could help improve some of the care around their patients, they really embraced it. I think they liked the model and recognized it was good care. It was sort of resource intensive, and the resources were all people. It wasn't about technology, it was about people. And so that costs a little bit of money, and that was an investment up front, but it really has worked well, and well enough that we want to continue using that model going forward. The statistical analysis is a little bit involved, so the statisticians still have those numbers, but we did show reductions in readmissions for 3 of those 4 illnesses. There was a lot of patient satisfaction with the new model, and the practitioners liked it as well.
Leslie Benelli, and I'm the Director of Quality and Risk Management for the Physician Network in Lincoln, Nebraska. I just received a letter this last week from a patient, and it was very moving. She just talked about her health coach, what the different disease things that she had going on, multiple goiter, hypertension, overweight, diabetes, drooping eyelids. She said at 69, she said it was overwhelming. And she said, my health coach helped me overcome these issues one by one.